Good evening, welcome to News Night Talk.
Good evening, and thank you very much for having me.
So glad that you made time to join us. Help us understand, when we talk about mental health condition, what is it that makes people get scared of one people or the other?
Yes, thank you very much for that question. You know, mental health conditions shouldn't be something we should be scared about, or anyone for that matter should be scared about. It's just like you having any other condition like malaria, like diabetes, like hypertension. So people that you interact with on a daily basis can have one mental condition or the other. So you shouldn't be scared about it, you know. But broadly, we have mood disorders. Example is depression, bipolar. We can have substance use disorders like alcohol use disorders, cannabis use disorders. We can have the childhood disorders like autistic spectrum disorders, attention deficit hyperactivity disorder. We can have personality disorders. I mean, so one doesn't need to be scared of be afraid of somebody having a mental condition.
Okay. During time that people are going through some of these mental disorders, what is the condition that should be very much paid attention to in order not for it to degenerate into a worsening condition?
Okay, thank you very much once again. So we should, once people have an awareness or have information about mental health conditions, they are able to take action or seek early treatment for somebody that they suspect might have a mental health condition. And so this awareness that we are creating would also help in that aspect. For example, if somebody is having a mood disorder like depression, you find that the person will have a low mood, may not be interested in activities that previously used to make him or her happy, maybe suicidal, maybe withdrawn from other people. So this should be a red flag to anybody who is close to the person. And one thing that we should also notice that for somebody having mental disorder, it tends to interfere with his or her social functioning and occupational functioning. So these are red flags that you should know and then try to help the person that you know. Yeah.
Help us understand how serious this condition is, because we know sicknesses like malaria where people do go for checkup from time to time. At what stage in one's life, and what are the things we should look out for if we start experiencing these things that we should go for checkup as far as mental health condition is about?
Okay, so I mean, like I'm saying, broadly, we have broad categories of mental disorders, from the childhood and adolescent disorders, the mood disorders, the personality disorders, the substance use disorders, and each one of them have their own symptoms that they can present with. You know, so depending on the condition, that will determine whatever symptoms that you may look out for and seek for help. What I can see is that we have services available for any mental condition that you suspect somebody may be suffering for. So if you feel overwhelmed in whatever situation you are going through, or whatever condition that you suspect someone may be having, you can seek for help and we assess you. A mental health expert assess you, and then we can take it out from there. It's difficult for me to zone on a particular one unless you give me a specific condition, then we can talk about that.
I would need you to help me understand when it comes to the age brackets, how if children do go through mental disorder at all. But before that, WHO, that's the World Health Organization, makes us understand that there is 2% for when it comes to funding for mental health disorders. What is the picture here in Ghana?
Yeah, so thank you very much. And that's why we even have the theme for this year's World Mental Health, that is mental health in an unequal world. You find that there is less funding for mental health activities, especially in the developing countries. For Ghana here, our Mental Health Act, 2012 Act 846, stipulates that there should be a clear source of funding for mental health activities. And we even had a legislative instrument that was passed in 2019. But till now, we don't have any clear source of funding for mental health, in Ghana here. So that's a major challenge. And I'll use this opportunity to call on government to, as a matter of urgency, help us get a clear source of funding for mental health activities. And this would help improve access to mental health services so that people will not have to pay when they seek for mental health services.
Nationwide, how many psychiatrists do we have? I mean, trained psychiatrists do we have in our country, health facilities attending to some of these mental health disorders?
As at December 2020, we had 44 psychiatrists, and the source was the Mental Health Authority website. But since then, we've since had about 9 or so psychiatrists added to the 44 that we had. So we are looking at about 53 psychiatrists. And we have them mainly been in Accra and then Kumasi, some few in Cape Coast. I think we have one in Ho. We have about 2 or 3 in the northern region.
Are they enough compared to the number of people who do visit these facilities as far as mental disorders are concerned?
No. So if you look at the statistics, we have a huge treatment gap, especially in Ghana. The last time studies was done, that was about 10 years ago. We found that the treatment gap, that is the number of people who need mental health services, the difference between the number of people who need mental health services and then those who actually get the service was over 95%. But since then, the numbers have increased, so we will be looking at about 80% thereabout. So this is woefully not enough, and I think the geographical distribution too is not good enough.
Okay, we want to thank you so much for getting time to speak with us on News Night.